Cancer. About 8 million people died from cancer in 2010 worldwide, and more than 5 million of those deaths occurred in low and middle-income countries. Of worldwide cancer deaths, about 4.2 million occurred before age 70. In low and middle-income countries, much of the cancer deaths occur before age 70, but in high-income countries like the United States, most cancer deaths occur after age 70. Smoking remains the biggest cause of cancer deaths worldwide. Tobacco use accounts for about a third of all cancer deaths before age 70 and increases the risk of cancers such as lung, oral, and esophageal cancers. As well, infections account for about a quarter of all cancer deaths before age 70. Stomach cancer is caused by Helicobacter pylori, a chronic bacterial infection. Liver cancer is caused by hepatitis B virus, and cervical cancer is caused by human papillomavirus. Infection-related cancers are a greater proportion of the cancers in low and middle-income countries than they are of the proportion of cancers in high-income countries. And it's simply because these infections are more common in low and middle-income countries. Over the last decade, the age-standardized death rates for cancer worldwide, before age 70, has fallen by about 10%. The greatest declines occurred in infection-related cancers, such as stomach cancer. But because overall death rates are falling even faster, the proportion of all of the deaths due to cancer is actually increasing, such that the absolute number of cancer cases is set to rise dramatically over the next 2 or 3 decades. Now, this is for a few reasons. First, there are more people reaching middle age or older age when the effects of cancer appear. The second is the effects of smoking and other key risk factors, which continue to increase. Effective cancer control needs the entire spectrum of interventions, including prevention, most importantly tobacco control and vaccination, screening and early diagnosis, as well as treatment and palliative care. In high-income countries, just over half of all cancer patients survive with effective treatment. In low and middle-income countries, however, 2/3 succumb to cancer. This shows the differences in survivability as a result of access to treatment. However, a third of cancer deaths are preventable, and a third are curable if they're diagnosed early. For example, there are big differences in different parts of India in cervical cancer deaths. The lowest rates occur where the effects of human papillomavirus are believed to be the lowest. One way to think about this is that if all Indian women had the same rates as these low HPV transmission rates, there would only be about 7,000 cervical cancer deaths versus about 30,000 deaths in middle age. This is important because strategies are being considered to accelerate simple screening and treatment for all married women and introduce vaccination against human papillomavirus. This in turn might help cervical cancer become a rare disease in the second half of the 21st century. For those patients whose cancer is not curable, the quality of their life and the suffering and death can be greatly addressed by pain control and access to basic palliative care. Now, can cancer be controlled? Yes. The most compelling evidence that cancer death rates can be reduced in middle age comes from the United Kingdom between about 1970 to 2010. During this time, deaths from tobacco-related cancers declined significantly, for example, lung cancer, and that was a result of smoking cessation. Breast cancer deaths have fallen by half in the last decade or so, thanks to treatment after early screening. Other cancers, such as colorectal cancer, are also decreasing. Reductions in most low and middle income countries from cancer, however, are not likely to be as rapid as they were in the United Kingdom. This is for a couple of reasons. First, smoking-related cancers are currently a smaller proportion of total cancers in low and middle income countries. However, effective tobacco control, particularly higher taxes, would reduce mortality. Widespread access to screening and treatments for breast and cervical cancer would also reduce cancer deaths. Expansion of vaccination against human papillomavirus or hepatitis B vaccine, the major cause of liver cancer, would also reduce cancers. So the bottom line is not to think of cancers as a fatal and incurable disease. Many cancers, if detected early, can be cured. And importantly, many cancers can be prevented through simple things like smoking cessation and vaccination.